Hello, everybody. Welcome to the 2018 National Healthy Homes Month webinar series. National Healthy Homes Month offers an opportunity to learn more about housing and its impact on health and provide resources to encourage local activities, as well as empower families to protect themselves from hazards in their home. This June's outreach activities aim to greatly boost awareness and understanding of what federal and local resources are available to make a difference in the lives of all residents, regardless of where they live. For more information about National Healthy Homes Month, including resources for your program, you can visit www.hud.gov/healthy homes. Today's webinar is How Are We Going to Pay for This? Healthy Homes for Residents with Limited Financial Resources, presented by Jane Wyndham from Healthy Homes Training Center, Healthy Housing Solutions Incorporated. We're pleased that you have joined us for this event. This webinar series is sponsored by the HUD Office of Lead Hazard Control and Healthy Homes, the USDA National Institute of Food and Agriculture, and the National Healthy Homes Partnership. This webinar will last approximately 45 to 60 minutes with 15 minutes at the end for questions. At the end of the webinar, you will be given information on links to additional resources for your program. We will be recording this webinar and posting it for you for viewing later if you prefer. Finally, we ask that you mute your microphone during the presentation. You may unmute your microphone for questions at the end. If you have questions before then, please feel free to post them in the chat window or questions window. I also want to point out that we do have a handout that you can click on the handouts and download that. And also, we do have some poll questions, and the poll questions will be interactive that we will activate while Jane is speaking. So we hopefully that will run very smoothly. So without further delay, Jane, welcome, and we look forward to your presentation.
Thanks. Hello, everybody. And I did want to add in that this webinar was developed with funding from the U.S. Department of Housing and Urban Development for the National Healthy Homes Training Center and Network. The Healthy Homes Training Center is managed by Healthy Housing Solutions and has a network of 34 partners who deliver courses on healthy homes around the country. We're going to try to keep this a little bit active today if we can, and ask you to participate in a few polls with us. We do have a somewhat large registration, so I'm not certain how it's going to work out in terms of us being able to get the results in real time, but we're going to give this a try. So without further ado, we do know that the job that each of you has will have an impact on, not only how you view this webinar, but also how you implement any of the guidance and the information that we provide. So we're going to try to get an idea right now of what everyone's job function is.
So Jane, I just, sorry to interrupt, I just found out I can read the results. So as soon as everybody has taken the poll, I'll give you a breakdown of how everybody answered. So we're still getting people answering.
Perfect. Yeah, we recognize, that you might have a number of activities, so obviously just pick the best choice that you can for your main activity.
We'll give everybody about 15 more seconds and I'll close the poll and then I'll give you the results. So. Okay, Jane, so we got about 24% conduct home visits or inspections, 10% supervise those who conduct home visitations, 23% provide services directly to the public, 5% supervise those who provide direct services, and 40% coordinate and administer one or more programs.
Great, thank you so much, Michael. This is kind of tongue-in-cheek because the good news is that you will not need to take notes other than I may ask you to write down a sentence or two, and we'll get to that. So you might want to have a writing utensil handy, but we are providing you with a web page and also a job aid, which is attached here that you can download that has the resources for this webinar listed on it. So part one of this webinar is looking at changing your mind, and the rest will follow. One of the things we want to also get a sense of from you, if possible, is why it is that you do the work that you do. You know, we understand that many people do their job primarily to earn a living and get a paycheck. You know, but this is a larger and more basic question related to you know, specifically why most people in this field do the work that they do.
So people are now answering that poll.
Great.
Almost everybody has voted now, so almost there. Okay, on this one, a very large majority answered, I help people have better lives, and a few people said my agency can say we reached a certain number.
That sounds like a very honest response to me for some agencies. So thank you for that. Yeah, it's generally a common theme that most of the people who work in this field will say that they do what they do because they want to be able to help and to make a difference. So we all know it is difficult sometimes to find the funding for the actual healthy home fixes. You know, we noticed that nobody responded and said, I want to be able to point out what's wrong, but not worry about fixing any of it yet. You know, we tend to really feel ownership when we walk into homes and find problems. You know, and to have to tell a client, for instance, that there's a leaky roof, it's contributing to the mold, could cost you, you know, in the $800 range to fix, but gee, I'm sorry, I can't help you with that. You have a high radon level in your home, you need to have a mitigation system installed. I'm sorry, I can't help with that cost. Same thing with, you know, some exhaust fans, and these are common things that we run into with folks, right? So the idea is that we want to be able to go forward and figure out a way to actually provide services to folks. So oftentimes when we're entering a home, you know, are we thinking more from the perspective that what is it that my program funds? And sort of secretly thinking behind that, because I can't fix problems that my program doesn't have any funding for. We should start looking critically at this perception that the only things we can address are the problems that we have program funds for. And what we're going to try to do here is help you start thinking more broadly about other sources of funding that you can bring toward your work. We find ourselves sometimes in this position, right? The person, you know, we might have a resident who has asthma, and we go in to visit. We find this huge problem with you know, a large leak in the ceiling. It's letting significant amount of moisture in. We might have mold developing. But the program that we're representing at the moment just provides mattress encasements, and we're going to help the resident address dust mites and maybe bed bugs while we're along with it. But we don't really know how we're going to get to the cause of that moisture issue and getting that thing repaired. That encasement is going to help somewhat, perhaps, with the asthma, but you know, it's kind of like putting a Band-Aid on a gunshot wound at this point. So we're trying to figure out how we can develop a new mindset with this and get a much more holistic view of the home. So we're going to start looking instead at 3 new questions that we can start asking. so that we can develop this new mindset and hopefully get to some more impactful new results. So we're going to try to suspend that "what does my program fund" question and start considering some new questions as we go forward. We can hopefully get different results that will then help us fund these important fixes for folks and get their problems solved. So we're going to try to reframe that one question in 3 different ways. So the first one would be, instead of just saying, "what does my program fund?" we're going to put that aside for a minute and instead say, "what is it that the house needs?" So that's one of the ones I want you to write down because you're going to need it for later. So what does the house need? Our second, continuing with that theme of reframing that question, our second reframe would be now to think about what are the highest priority fixes for the house. So, not surprisingly, I'd like you to write that one down too and think about what are these highest priority fixes for the house. And the third way we're going to reframe that question, instead of just saying, "what does my program fund?" is, well, if I can't fund that fix, what are the other programs that will fund it? So that's the third one. If you could write that one down as well, please. So in summary, these are our 3 new questions. We want to think about what the house needs, exclusive of how we're going to pay for it, then determine what the priorities are by thinking about what the highest priority hazards are or fixes that we need to incorporate. And then if we don't have the money, what other programs will fund that? So far we've put this in the context of why what you do is so important. Thinking about how do we get the biggest impact? Do we find that it's working for us right now if we can fix only the problems that we have our program funding for, or do we want to expand that and take a more holistic view of the house? And these are our 3 new questions that we want to ask going forward. What does the house need? The highest priority fixes for the house, and then thinking about who else can do the funding. So this is where we want to start. We always want to start with our local agencies. Funding sources are kind of a tricky thing to understand sometimes. We often hear that there are these federal programs and they all have millions of dollars for this variety of housing programs to get done. So oftentimes people are asking us, well, where's that free money? How do I get my big bag of money? One of the first things we want to keep in mind is that almost all of that federal funding for healthy housing fixes is not going to be directly accessible to us as individuals or small programs. It flows downstream from the states and local jurisdictions. So it's good to be aware in general of what the federal funding sources are. It's much, much more important that you're familiar with your local sources of funding. So in this session, we're going to focus on identifying and developing some of the local relationships so that you can access these federal funding sources. Time for another poll. So we want to get a sense of how connected you all might be to your local landscapes. If we could launch this poll, Michael, so that folks could give us a sense of how many organizations they might be able to tell us from their city, county, or state, however it is that you define your location, that could fund housing, rehab, or repairs.
We got a bunch of people already taking it, and in a little bit, it looks like about half the people have voted. About 75% have voted, so people are very attentive and voting. Okay, so the results are, let's see here. A couple other people are still voting, so. Okay, so about 12% said 0, 48% said 1 to 2, 33% said 3 to 5, and 7% said 6 or more.
Thank you, Michael. So we usually consider that, those who are in the 3 or more category are in a very good starting place. But the good news for the other 60% of you is that that's exactly why you're in this webinar, and we're going to try to up that percentage before today is over. So part 2 to that question is, also to get a sense of your comfort level with the and your familiarity with these programs. So how well do you know the organizations that you listed in the previous question?
So we have a number of people who are voting. I'll let you know. About a third of the people have voted. I appreciate everybody voting really quickly. That way we can get the results back to everybody and to Jane. Almost have everybody voted. So the trend right now is there are about 10 to 15% in the middle 2 answers, and then about 30% say they know the programs and the people to contact, but a very large percentage, about 45%, say, I know they have programs, but I'm not sure what they offer. So the first answer is the most popular right now.
Okay. So the 30% of you who know the programs and the people to contact, we sort of consider this the you're in the I've got this category. So congratulations and good for you. But we're going to talk about this very thing for the rest of you in terms of determining who does what, who covers what, and how we can all start working together. So when we're thinking about this local landscape, it might require a little bit of an investment of time on your part. Understanding the local programs and creating those relationships with the people who run them is really critical to do on the front end before you actually need their services. If you try to start this process when you have a family who's already got an emergency, it's likely going to be less effective, right? So we want to find out what programs they have, what sort of activities or fixes these programs will cover, and also, who the staff contact would be. So here's kind of a broad view of the local landscape that you could consider, and it covers, multiple types of organizations that may be in your area. Every community is going to be different, so you may not have all of these options available, but you'll have some combination of them at least. I do want to note that the property owner or the property manager is right at the top of the list here. We always want to start at this point, particularly if we are in a rental property. At a minimum, we want to make sure that the owner or manager is involved in decision-making about repairs, but they may also have resources to contribute. In some areas, we want to keep in mind that landlords are required by, local habitability codes or laws that they need to fix substandard conditions as well. So this is not an attempt to offend any of the car enthusiasts out there, but our point here is that all the programs that we're going to talk about today incorporate this same goal, that they, fund rehabilitation work or repair work in some way in a home. So, we can just look at them all as being different vehicles that can get us to the same place. whether we're talking about the federal weatherization program, state and federal led or healthy homes programs, homeowner repair grants and loan programs, or even some of the municipal housing rehab programs. So actually finding some of these local resources is pretty easy, particularly since most of us have access to the computer at this point. So if you Google some of these categories here, for instance, look for community development organizations or CDCs, housing repair programs, housing rehab services, emergency home repair, elder home repair. You can see if your city or county websites might also have housing assistance programs that are listed there, and we are going to provide a link for you to the Home Matters Community Connector tool as well. So these programs are all going to have, sets of eligibility requirements. Many of them are based on income, ownership of the property, who the clientele might be. So these are things to all keep in mind when we're trying to leverage and put these resources together. Something also to keep in mind is that even when you are looking at resources that maybe are all through the same city or jurisdiction, they might have different qualification guidelines for them. Other programs that are available are often volunteer programs or faith-based and religious organizations very often run housing repair programs as well. Something else to think about are any programs that are making elder home visits. Meals on Wheels, for instance, is getting involved in the home repair business at this point. So considering these type of organizations is going to be particularly valuable in rural areas where there might be fewer state and federal program resources. You may also find that with these organizations that the intake and the qualification process might be a little bit simpler. So in terms of finding some of these resources, another good place to go is to the HUD website that's listed here. You can click on your own state, learn about home ownership, and underneath that you'll see a box that talks about home repairs. So that'll be a really good starting point for you to develop a resource list. So we have a couple of examples of program and partnerships that have worked across the country. We're going to look at these quickly. And again, remembering that all of these programs are going to have, sets of eligibility requirements. The first program we're going to look at is a particularly extensive program that's in St. Louis, Missouri. The Home Repair Network there has 60-some agencies listed as members. So we're going to highlight a couple of those key members right now. The City of St. Louis Healthy Home Repair Program. It's through the Community Development Administration. This program is for homeowners who live in the city of St. Louis, and some of their eligibility parameters include income guidelines. They need to have clear title and be up to date on their payments, taxes, and insurance. To qualify for that program, the eligibility is limited to households who are at less than 80% of area median income. AMI, we refer to that sometimes. They do have, as you can imagine, quite a waiting list for that, but it's a very popular program there. The Missouri Housing Development Commission provides financing for construction of affordable housing, but they also administer the low-income housing tax credit programs, the Affordable Housing Assistance Program tax credit, the federal home funds, and they also directly fund several housing assistance programs. So, we might tend to think of some of those organizations as they're only for larger new construction and tax credit deals, but it's definitely worth checking out because, like I said, in this case, they are funding housing assistance programs as well. And the third one, Better Family Life Incorporated, provides a variety of training and community support services.
So Jane, we've got a question, if you don't mind, because it
Not at
applies
all.
to the slides you're talking about. So one of the webinar participants is asking, can you replace mold and water damaged ceiling before the roof is repaired? We in Pima County have a household where the house needs major roofing improvements, most likely a roof replacement that will cost more than the $5,000 Healthy Homes limit. The plan is to complete lead hazards control work and use the Healthy Homes grant to address water and mold damaged sheetrock. Thereafter, the home repair program will be followed up and complete the roofing improvements. And I just want to point out, this is actually a pretty common thing about what kind of repairs can go on beyond just the Healthy Homes repairs. So that's something you can answer?
That is not something that I would feel comfortable answering, Michael. Only, I obviously have my personal opinions on it,
Sure.
but this is an instance where we would definitely want to check with the specific funder to find out, how they would allow us to apply those funds and in what order. Of course, it makes more sense to get the roof done before the ceiling because it might rain tomorrow.
Right. Thank you.
You're welcome. So, Better Family Life, the last one of these organizations in the St. Louis program I wanted to talk about, actually houses the local HUD certified counseling agency, and you can find those nationally on the website from the previous slide. So primarily they provide home buyer and home ownership education, affordable and sustainable housing opportunities and so on, but they also have home repair and maintenance services. So along with foreclosure intervention and some of the more traditional counseling services. So it's it's good not to assume that, oh, they just do counseling over there, for instance, and call people, get to know people, find out exactly what it is that that they do. You may be surprised that they have other resources we're not aware of. Our second example is from the city of Philadelphia. They have a couple of different programs. They have home repair programs and they also have loan programs. So I'll talk about the repair programs first. There is the Basic Systems Repair Program, which is in box down here at the bottom. They provide free repairs for qualified owner-occupied homes in Philly, and these can include electrical, plumbing, heating, and even structural and roofing emergencies, for instance. They have an adaptive modification program that helps individuals who have permanent physical disabilities so that they can live more independently in their homes. The Heater Hotline program makes emergency heating repairs. Senior Housing Assistance Repair Program makes minor repairs in homes that are owned by residents who are 60 or older. And their Weatherization Assistance Program is incorporated here and helps homeowners and renters make their units more affordable. For the loans, they have the Mini Fill and the Fill Plus. So those are home improvement loans for homeowners that have less than perfect credit, so that they can do work on their homes and they may not have been able to get a loan elsewhere. And the Renovate and Repair Loan Program helps homeowners maintain and improve homes as well. So those are all in Philly. And the third example is from Pierce County in Washington. Brian Sarenson works for Pierce County Community Connections in Washington, and that's an umbrella department that manages over 50 different programs. I'm going to ask you to indulge me for a minute while I just read this case study that Brian shared with us about one particular client that he assisted. So this is a picture of Mr. Shaw. Mr. Shaw is a senior citizen with income from Social Security and disability. When he and Brian first met, Mr. Shaw was gasping for breath and just sitting trying to talk to him. At the initial audit of his home, Brian found that the ceiling was open, the roof was actively leaking, the home was drafty, his furnace was not operational, and the only form of heat was from a failing wood stove that had a cracked face. The house had no ventilation fans, there were plumbing issues, and the floor was torn up and lacked insulation. So Community Connections received a grant from the Washington State Department of Commerce to provide Weatherization Plus health services. The Weatherization program teamed up with Community Connections Home Repair, Aging and Disability Resources, and the Pierce County Health Department to make numerous repairs to the home. Another thing they were able to do through Weatherization Plus Health was send a home visitor from the Department of Health to assess Mr. Shaw's asthma. And they developed a plan and that they sent to his doctor to help improve his asthma control. So for Brian, the best part of the job was the final home inspection, where Mr. Shaw just couldn't sit still. He was constantly on the move. He had no more shortness of breath, no coughing and wheezing, and was thankful and full of gratitude for the work that he said changed his life. So there we go. All of us who want to have a positive impact on someone's life. Here's a perfect example. He was saying that he sleeps better now. He's sick much less often. He rarely sees his doctor and spends most of his free time being able now to help others in his community. Again, still in the local landscape, let's think about the hospital community benefits. Nonprofit hospitals are required now by federal law to spend some of their surplus on community benefits. So these are goods and services that would address a need in the community. A recent review of some reports by hospitals revealed that there are 3 major areas of activities where they are supporting healthy housing through home assessments, affordable housing development, and systems change. The website for that report is also going to be provided in the resources for this webinar. Couple of examples of community benefit spending on home assessments. In Connecticut, the Yale New Haven Hospital Regional Lead Treatment Center, is screening homes for hazards, and they have joined up with St. Francis Hospital Medical Center in Hartford, and they deploy program staff to visit and assess homes for not just lead, but also 29 other health hazards. In Indiana, St. John's Health System supports Healthy Families Indiana, which is a voluntary home visiting program that serves families before and immediately after a child's birth. They provide postage, utilities, mileage reimbursement, phones, and pagers, again, for families with newborn children. In Iowa, the Mercy Medical Center in Cedar Rapids runs the Children's Home Asthma Management Program. They provide infectious control practitioners who will actually go in and assess air particles, moisture, and cultures in the homes of children who are newly diagnosed with asthma. In Massachusetts, Boston Children's Hospital's Community Asthma Initiative conducts home environment visits. They provide educational materials and supplies to reduce trigger, even including HEPA vacuums in that case. My suggestion here would definitely be that we need to knock on the doors a little bit more of the community hospitals. They very often will say no the first time, but we want to ask again. One way to consider getting them to want to contribute to your particular program is perhaps finding out who's on their board and see if somebody on your board knows them, or if they'd like to join your board as well, and they may be much more interested in funding some of these programs going forward. Rural areas, you might need to dig a little bit deeper for some of your Healthy Homes resources, but just like with the urban areas, it's those pre-established relationships with the other organizations that are really going to help you. I want to look at these 3 important areas to remember. Instead of going to your city or your county for program resources, you might find that the programs at the state level will be able to directly help your area. The second thing we want to think about is really relying on those volunteer-based organizations. They're going to be particularly critical in rural areas for both supplies and resources. Organizations like Rebuilding Together that specialize in owner-occupied home repairs are very important. And, you know, we don't often think of Habitat for Humanity as constructing, we often think of them as generally just constructing new homes, but they also assist with housing rehab in many communities as well. So again, it's getting back to that, not just assuming we know what people do, but go meet them, find out. And thirdly, in rural areas, it may be more important for you to focus on obtaining free or low-cost healthy home supplies and see if you can help residents determine some of the things that they can do on their own. Most important thing that you can do, though, is still to make sure that you develop and maintain those relationships with the organizations who can help out. So, quick review of that section. Make sure we start local. Get to know those organizations now, develop good relationships with them. Go online and look. Learn from others and just go out and meet people. We'll do a quick overview of some of the federal and state funding that's available. So these are some of the federal resources for housing repairs. Again, as we mentioned earlier, that it's good to be familiar with these programs, but remember that, you know, your access to them is likely going to be through local programs that receive their funding through this trickle down. So lead-based paint hazard control programs, you know, although these program funds cannot be used directly for Healthy Homes work, a lot of the grants will include a Healthy Homes supplemental fund that is specifically for that purpose. And also keeping in mind that coordinating work write-ups can be really key, because one fix can often address multiple hazards. You know, if we're replacing old lead-painted windows under you know, the hazard control program, we can also take advantage of that opportunity to address moisture and comfort and safety as well while we're at it. Jurisdictions may also combine block grant funds that they would use for traditional rehab with lead hazard control grant funds, so that they can get, you know, more bang out of the visit, so to speak. National Housing Trust Fund, which, you know, generally is designed to produce, rehabilitate, preserve, and operate rental housing for low-income households. These housing trust funds are actually distributed as block grants to states, and then the states designate an entity to receive the trust fund dollars and administer the program. In HUD's interim rule that covers the implementation of the activities for the trust fund, they include a number of healthy housing provisions as well. Medicaid is the main public health insurance program for people of all ages in the U.S., and there will be, I'm going to talk more about that when I actually get to the next slide. The Weatherization Assistance Program has a whole host of health and safety measures that they include as part of their weatherization assistance, although they will not be done separately. They need to be done as part of a weatherization. These programs, also something to keep in mind, is that they generally qualify their individuals' income a little bit differently. So they're going to be working with a percentage of federal poverty level as opposed to area median income like we will on a number of the other programs. So qualifying a client for, you know, more than one of these programs simultaneously might take, you know, a little bit of work in terms of more than one intake or more than one application. It is a little bit of a challenge to get staff from multiple programs or agencies to clients at the same time. And integrating those intake and work write-ups on the front end, it's going to seem a little bit cumbersome, but it ultimately can save a lot of money and time and avoid duplication of resources as well. So back to the Medicaid question. Understanding this program and all the different processes that are used in every state it's somewhat complex, so it's not going to be possible to cover all of it in this short webinar. But the National Center for Healthy Housing is an excellent resource on this subject. They have a lot of details available on their website. if you go to that link that's right there and is again also in your resources page. What I can tell you is that 19 states have been successful so far in obtaining Medicaid reimbursement for in-home asthma services, including interventions for housing-related repairs. Several other states are also investigating this. State Medicaid offices control much of the potential for making Medicaid work for community-based preventive services. So, it may be something that's a little bit at a higher level in your area. So you'll want to check with your state office. So, finding the Lead in Healthy Homes grantees in your area. If you have a grantee there, they may be able to help provide some resources or assistance for you as well. This website will take you to the map where you just simply click on your state, and you can find out who the local grantees are in your area. They're not going to be in all states, as you see, but they tend to be in the areas with the most need. And that changes every year as funding's released. So one of the examples that we talked about earlier was radon mitigation. Where would we find funding for something like that? We have the programs that are listed here on the slide. They allow radon mitigation to be done with their funding, but these are all loans for home buyers. So a couple of different kinds. FHA has the 203K rehab loan or a renovation loan that allows home buyers to either purchase or refinance their primary home and renovate it with this one loan instead of having to apply for multiple ones. Part of the loan proceeds go to pay the seller, or if we're doing this on a refinance, it will start paying off the existing mortgage, and the remaining funds are placed in an escrow account. Those get released as the rehab is completed. So, some of their eligible activities are structural alterations, elimination of health and safety problems, plumbing, wells and septic systems, roofing, gutters, downspouts, accessibility enhancements, energy conservation improvements. We also have the Title I home and property improvement loans. Although HUD doesn't lend money for property improvements, they do insure private lenders against loss on property improvement loans that they make. So you can look in HUD's list and find approved Title I lenders by state. Loans on single-family homes can be used for alterations, repairs, and site improvements as well. And these can be used in conjunction with the 203K loans, the rehab mortgages that we just talked about. Fannie Mae has a couple of products. They have a renovation mortgage that provides a way for borrowers who are considering home improvements to make repairs and renovations with a first mortgage rather than having to have a second mortgage or a home equity line of credit. They also have a home style energy mortgage loan that helps so that lenders can offer financing when borrowers are looking to improve the energy and water efficiency in their homes. So, quick review of that was we want to make sure we're familiar with those federal funding sources, and just again recall that you're likely to encounter that money more through local programs than directly applying for federal funding. So we're going to look at trying to bring this all together. If you could hold off for a second, Michael, on the poll for this. I just want to talk about this for a minute.
Sure, no problem.
So, looking at this slide, we have Sarah Owens, who works for the LeadSafe Denmore County. Her primary responsibility is conducting lead risk assessments. So she's going in to assess a single-family home for lead-based paint hazards. She's got a 67-year-old grandmother and who has custody of 2 grandchildren who live there. So previously, when Sarah went in, she would have just gone in to determine the presence of lead risks, assessing lead risks and remediating any problems that she found there. Because that's what her program could fund. But because she's attended this webinar, she now focuses on this more whole house approach. So if you think back to when we talked about changing your mindset a little bit, many of you might have entered the house thinking, what is my program fund? So we're going to try to go back to how we reframed that into those 3 questions to consider. And we did ask you to make note of those. So now we could launch the poll, Michael. What's the first question that Sarah should be asking herself now that she has a whole house approach?
Let me launch that.
Thank you.
Okay, we have about 3/4 of the people have answered. As soon as it answers, I'll actually go and publish it so everybody can see how everybody voted. So. Okay, I'm gonna close the poll and I'm gonna share it. So that was the answers you got. Can you see that?
I can't.
Okay, so a majority of the people said, what does this house need? 93%, and then there's a few percentage on each of the other answers.
It works out so well when we ask people to study ahead of time, doesn't it? And
Exactly.
write the questions down. So yeah, that was what we were going for. There was that the first question she would ask would be exclusive of how we're going to pay for it, not getting ahead of ourselves. Just look at the house holistically and think about, what does this house need? So in part 2 of this, Sarah now completes a thorough assessment of the home. So in addition to the lead hazards that she found some other serious problems here. We've got a leaky roof. There's moisture damage to the ceiling in the living room from that. She's got a leaking toilet that's causing damage to the bathroom floor. We see mouse droppings indicative of pest infestation, a broken smoke alarm. The owner is complaining about cold temperatures in the house, even though she turns the temperature up as high as she can. We've got some electrical outlets that don't have cover plates. So now that we've got these hazards identified, we want to think about what Sarah's next step would be. So getting ourselves back to, thinking about the second question related to changing our mindset.
So I have the poll open now.
Next step should be, yeah.
So people are voting. Okay, so it looks like most of the people answered, what are the highest priority fixes for this house?
That's excellent. That's although these are all 4 of these are really important questions. Going through this as a process, that's exactly what we were looking for, was what are the highest priority fixes next. So part 3 of this, as we get ready to close out, Sarah's now going to start considering, now that she's sort of prioritized what the issues are, what funding sources might be available to cover the costs. So this is the last piece of our puzzle, sort of brings us full circle on, who's going to pay for this, right? What are some of the funding sources that might address each or any of these hazards, because not every source would cover each one of these hazards.
So I've got people voting on this one. I think I'm going to be really pleased with the answer.
And it's really all about making me happy. So.
Okay, almost have everybody voted.
This is going amazingly quickly for this many people.
Well, we got good attendees. Okay, so the overwhelming answer that people gave was all of the above.
That's once again exactly the answer that we were looking for there. You know, it is of course going to depend on what resources are available in your area. You know, the programs may vary by where you are. So let's see if we can entertain any questions here. I am going to need you to tell me them, Michael, because I can't see things in the
Yeah.
chat.
Oh, yeah. Glad to. So I got a question a little bit ago that I want to start with first. And I want to ask everybody, so obviously this is Jane's information. A couple of quick logistics before I ask the questions. We are recording this webinar, so you will be given instructions after the webinar, maybe tomorrow, about where to find the recording. There is a handout that Jane has provided. So if you click on the handout portion, you can download that, and so that will be information that you can use for a follow-up. But the question that came in a little bit ago is, the person is asking, where can the list of the 19 states that offer funding for asthma interventions and assessments be found?
That is, we do have that report. If it's not on the link that's provided, I do have access to that report. Actually, Rachel Riley from HUD sent that over just yesterday. So if that's not in part of our resources, I do have access to that. So this gives you, if all else fails, my email address is right here in front of you, and I will track that down for you. So send me an email.
Perfect, thank you. So for questions, people are welcome to type out the questions in the questions window. You're also welcome to unmute yourself if you want to ask it through the phone or through your microphone. We'll give everybody a few minutes on the questions. These are excellent questions. Okay, so we got another question, I think. So Susan also said that she recommends that you follow the information you just gave about either emailing you or looking in the handout. So, okay, so here's another one. So I have, this is the person's question. I have a client that does not qualify for the lead hazard reduction program application due to recently entering bankruptcy, Chapter 13. The child does have a high elevated blood level. Where should I look to cover lead remediation?
That's a good question, and it is unfortunate when we have people who have, you know, are in foreclosure, in bankruptcy, and in other areas, and we can't, you know, we can't help them from that direction. Other people, I would be, you know, delighted if other people want to chime in here. I'm not claiming to be the end-all expert on that particular program, but I would, one suggestion I would make would be to check with your local Board of Health and you know, see if there are local resources available.
Thank you. So here's the next question. Can the resource about the asthma just be attached to the recording instead of us having to email? So if someone, Susan or somebody, if you can actually send it to me, I will publish it on here somehow. So I'm glad to do that. The next question after that is, Is this only for seniors living in the home, and or do you have medical conditions or disabilities? It seems all the examples are related to such.
So if I'm understanding, I don't know if they were asking about a particular program at that moment,
I
or
think I
just
think I
if the
think it's in
webinar
general.
in general was about that. Yeah. Um, we do tend to use the example of, I guess there are a lot of examples of seniors at the moment. I would say that, part of that is because there are getting to be so many of us as seniors that it's, there is quite a need. Um, Obviously, the lead program is, looking more at children, at young children. And there are some programs that were listed in here also for folks with disabilities. But, generally speaking, these programs are all looking to help the most vulnerable populations. And it does seem to be that it's most often young children, elderly, or people with disabilities who need the most help.
Thank you. So, couple of comments coming from participants related to earlier questions. One of the participants said in their area concerning bankruptcy, we got permission to be more lax on those types of qualifications for the lead program only. This is not local policy, and this is not HUD policy, it's a local policy. We let them have bankruptcy and get approval from their bankruptcy trustee. So that's actually a good suggestion. I don't know how applicable it is to other areas, but it's definitely something that I think people should check. And then the next comment was, in my area, we have a pay it forward Facebook site that allows people to give away stuff to people who might use it, no cost. And sometimes you can get some smaller stuff like bathroom fans and such, or pieces of drywall when there are areas that don't need a lot of repair. Smaller communities can do this, go back to trading or keep it out of the landfill type of thing. That's actually a very, very good suggestion, I will say myself.
Yeah,
Um,
we're going to add that to the list. Thank you.
Another comment, very difficult to get funding for rental properties that are not owner occupied. Do you have any suggestions? Our city has partnered with local community development to apply for HUD lead control grant for 4 years. No success. Seems our city is too small to qualify. Any ideas?
No.
Okay.
Not my area of expertise. I know that it has been successful for some rental properties in some areas. I worked in a jurisdiction previously where we served a tremendous number of rental properties because that was primarily the housing stock and where we had the most need. But in terms of getting a particular area funded with those HUD funds, I would check with them, see what they're looking for on the application, maybe.
Uh, Thank you. You're getting some pretty challenging questions today. I know that this has a lot of interest because I think everybody's comment is, well, we're going to get the money for this. So I think you've done a great job of, opening the door to a lot of opportunities that people may not have thought of. So the next question is, I manage a lead hazard control program with the Healthy Home Supplement. We are finding a lot of buildings with asbestos during our Healthy Homes inspection and with very high cost of abatement. Our HH allotment rarely converts this work, and we are finding it very hard to fund this work through our program or other city grant programs. Do you know of any funding source specifically that I could reach out to?
The only one that I can think of, and I have to think of the name of it, I think it was the fund for Zonalite, but that was if there was asbestos in vermiculite insulation, attic insulation. But it doesn't help with, if it's in drywall and on other areas. It was specifically for that vermiculite insulation. So other than that, or possibly some of those home improvement loan products that we talked about in terms of direct grant funds for that, that's the only one that I'm aware of. I don't know if anybody else has suggestions on that.
If you do, you're welcome to type it into the question window and I'll read it so that everybody can see it. Next question, we'll handle a couple more questions. Is there a distinction in resources for tribal communities?
Not my area of expertise. I couldn't
Uh,
say.
I will say this, that for those of you that have the same question, we do have, this is a webinar series that we're doing through National Healthy Homes Month. We do have one coming up. So if you'll go to where you registered for this one, we actually do have one on indoor air quality in tribal communities. And I do know that the presenter will be addressing this specifically for that webinar. So I would recommend attending that webinar. Okay, so next question is, you had mentioned certain areas have different programs and funding sources. Where would we find the funding for these programs, especially things for like asbestos and radon remediation, where there are no uh, local agencies that offer the service?
Yeah, it would. It's definitely still checking through your local agencies and then going forward into looking at the volunteer programs. Sometimes foundations are available through some of the nonprofits as well, and you can make a case for funding from them, even though it's not a formal program. It's a long shot on that. Those things have been historically very difficult to get funding. There is no particular source for that.
I want to also add a very, very good answer. I want to add your partner Susan Issetti at HHS just also wrote, the problem I believe with answering specific questions is that the solution is almost always local, and so since Jane is doing an overview, it's difficult for her to speak to any particular community. So that's sort of a little bit of help to you from Susan. And I want to reinforce that there are some federal programs and statewide programs that they are going to vary. I think that one of the keys is on the handout. I know it does walk everybody through the process of, as you mentioned, Jane, there's the federal, the state, and the local. I think your handout is a really good resource for people who are looking for resources that may be more specific to their area.
We hope so.
Yes. Okay, we'll be glad to take one more question. So the question that just came in is there an age requirement or limit for children in the home that would make you most eligible or disqualify?
That's all going to vary by by funding source and by location. For the lead funds, clearly those target children under 6. But some of these other funds are, as we talked about, targeting folks who are over 60 instead. So it's really going to vary based on what the particular funding source is.
Okay. Jane, on behalf of the National Healthy Homes Month, sponsored by HUD, we really appreciate you giving this presentation. I will say that this is the most heavily attended webinar. I know it was a topic that everybody suggested last year that we address as part of the National Healthy Homes Month webinar series. And on behalf of everybody, you did a fantastic, excellent job. And I think we all learned a tremendous amount about resources that we may not be familiar with, and especially a process by which to identify a method of not only identifying the highest priority, but where to address the funding for those. So I appreciate you. You're getting a lot of thank yous written through the questions, but I will be stopping the recording here. Do you have any last minute things you want to say, Jane?
No, but thank you all so much for attending. It's always so difficult from here to tell if there's anybody out there listening, so I appreciate it. And it was my pleasure to have the opportunity to do it. Thank you.
You're welcome. And I hope everybody will attend the one. There's one coming up on Thursday, and then there are 2 next week. I look forward to seeing you at future webinars.